Hello, good day everyone. My name is Alonzo, a student nurse. Today I will be performing the proper donning and doffing of PPE return demonstration. Personal protective equipment or PPE are specialized equipment and attire that is usually used in the healthcare facilities not only by the healthcare professionals but also patients and visitors against the infection.
Just make sure you have all of the items ready before you put on the PPE. To begin, make sure that all jewelry and personal belongings are removed and that your hair is tied back if applicable. Next, put on your shoe cover. Shoe cover will act as the barrier between you and the contaminated environment. Please keep in mind that this is only an optional step. Then using an alcohol-based hand rub, do a hand hygiene. You can now put on your gown. Tie it around your neck and waist and secure it across your back. Make sure that the surgical gown covers all of your clothing. Put on the medical or surgical mask, making sure it covers your nose and your mouth. Pinch the metal piece together to achieve a snug fit. Once the mask is on your face, try not to touch it. Hand hygiene should be performed before and after touching it if necessary. You can now put on the surgical hat. Make sure it covers all of your hair. Next, put on the eye protection. And finally, you can now put on some gloves and make certain that they are put over the cuff of the gown and that no exposed skin is visible. At this point, you are now ready to enter the patient's room. Proceeding to the disposal of the PPE, first step is to remove the shoe cover by pulling it away and dispose it immediately. Next, remove the gloves by utilizing the glove-to-glove and skin-to-skin method. This is the filthiest object and should be removed first and safely discarded. Remove the gown by removing the ties and pulling it away from the body to avoid contamination of your clothes or the environment. Turn the gown inside out and carefully dispose it in the garbage or laundry hamper. Next, perform hand hygiene with alcohol-based hand rub for 20 seconds. Take off your eye protection by leaning forward and pulling them away from your face, whether it is a face shield or goggles. If the face shields are reusable, make sure to clean them and store them in a clean container. Next, remove the surgical hat and dispose it properly. The mask should then be removed by removing it from the bag and discarded in a garbage can. Make sure you're removing the mask via the straps and not touching the mask. And lastly, perform hand hygiene.